Hello, everyone, and welcome to today's SOAR webinar on the topic of rural homelessness. Today's webinar is presented by the SAMHSA SOAR Technical Assistance Center at Policy Research Associates under contract to the Substance Abuse and Mental Health Services Administration of the U.S. Department of Health and Human Services. My name is Pam Hines, Senior Project Associate with the SAMHSA SOAR TA Center, and I'll be moderating today's event. Before we officially begin the webinar, a few housekeeping items before we begin. The webinar is being recorded. It will be available for download on the SOAR website in a few days. Yours will be muted throughout the webinar. Right now, you may download the PowerPoint slides. You have options. First, if you look at the top left of your screen, you will see the word File, then click Save, and you'll be able to download the material. An option is to visit the SOAR website, which is soarworks.painc.com. Click Webinar, find today's topic, rural homelessness, and the PowerPoint slides and 3 handouts are ready to download and print. At the end of the webinar, you'll be directed to a link for an online evaluation. That'll up immediately, so we really value and appreciate your feedback, so take the time immediately following the webinar to complete it. Our future webinars. So briefly, review today's agenda and learning objectives of today's webinar. First, we hope that at the conclusion of the webinar, you'll have a better understanding of what rural homelessness is and how it looks, and how it impacts individuals living in these rural communities with accessing critical supportive services such as SOAR. We want to understand how rural homelessness differs from homelessness in urban settings and understand how rural states are implementing some of the SOAR critical components to help increase service capacity and delivery of SOAR services. So review the agenda. First, we have Abigail Lemon, who is a Senior Project Associate here at the SOAR TA Center. Abby provides TA to many rural states and has developed some guidance on rural communities, which is going to be available today for download as well. Next, we have Corey Snell from Kansas, who will be our first presenter. She will talk about some of the programs and initiatives she's implemented to help increase the quality of services and coordinate services in her rural state of Kansas. Finally, we have Ambrosia Crump, who is also a SOAR state lead out of Las Vegas, Nevada. And the state lead, Ambrosia, has implemented many of the SOAR critical components to really strengthen service capacity and delivery of SOAR services throughout the state, which are mostly rural in nature. Okay. So we want to start today with our first poll question. To get an idea about a little bit about you, we want to know what best describes your current role. Are you a SOAR state lead, maybe a local lead, an agency lead, or caseworker, or peer support specialist? And we have an option E for other, whether you're listening from SSA or DDS or other community partners. We want to know a little bit about who's out there. We'll take a few seconds to answer. Okay, close the poll. We have many SOAR providers out there in the community, so we're really hoping that you'll have some great questions for our presenters. Thanks for participating. So we're going to open the floor to Abby, who is going to discuss rural homelessness and its challenges to service access and delivery.
Thanks so much, Pam, and thank you to everyone for being on the webinar today. And before we go ahead and hand it over to our great presenters, I want to kind of frame the discussion of rural homelessness and how SOAR can be a benefit. So I think that this graph by the USDA is really telling. So often when we think of homelessness, we will often think of individuals experiencing homelessness in urban settings. But this graph, which shows poverty by region, so it breaks down the Northeast, Midwest, South, and West, and then it breaks down the rates of poverty into non-metro and metro populations. Even though this doesn't specifically relate to homelessness, we see that poverty rates tend to be higher in non-metro areas across the board. And traditionally, where there is high rates of poverty, this is going to lead to more individuals who are at risk of homelessness or experiencing homelessness. So of SOAR or homelessness in rural communities. We know that homelessness in rural communities often will look different than their urban counterparts. Many people may live doubled up or with extended family or friends or live well outside of the main town or city center. Rural communities also face high rates of poverty, a lack of resources and services or infrastructure. Communities can lack affordable and stable housing, and they may have limited funds or staffing. All of these things create barriers to accessing Social Security disability benefits. And this is one of the #1 reasons why SOAR works and why we're so excited to have two very well-versed and experienced state team leads on the phone with us today who are going to tell us about how they've been able to make SOAR work in their communities. So before to them, I just want to briefly tell you about an opportunity that the Social Security Administration has upcoming. SA's National Disability Forum, exploring opportunities to advance the disability program through telehealth and telemedicine. For those of you who may not be familiar, telehealth encompasses a variety of ways to use video and other technologies to enhance healthcare and education delivery, and telemedicine involves clinicians providing services, mostly over video or some other electronic device, to patients who are in different locations from themselves. So we're talking about homelessness in rural communities and getting our SOAR applicants seen by physicians. This can be a great resource. Social Security is going to be holding this forum on Thursday, October 27th in Washington, D.C., and you can see from the slide that there are going to be a number of great speakers there. Now, on the off chance that you're not able to get to D.C. to attend in person, you all have the ability to attend via phone, and the link to register for both of those is embedded in the slide. You'll just want to go ahead and register by the 25th. And lastly, Social Security has presented an opportunity to have your input or give input to SSA on telehealth and telemedicine, their idea scale website. And they're asking questions such as, how can we use telemedicine or telehealth in the development of claims to better serve individuals with disabilities? How can telehealth help expedite timely assessments of disability claims, and other questions? So Social Security is really seeking your input on how to implement telehealth and telemedicine throughout the country. So I would really encourage you to take advantage of these opportunities. And that, we'll look forward to our presenters, and I'll turn it back over to Pam.
Great. Thanks so much, Abby. Yeah, please take advantage of the opportunity that SSA presents, especially if this is a way to assist our applicants with obtaining treatment. So I know we are going to be attending, and we think that you're going to learn a lot about this new resource that's critically needed for folks in rural areas. This brings us to a second and last poll question. We would like to know, does your community utilize telehealth and telemedicine services? So yes, no, but I'd like to learn more about the topic, or you're really unsure but still want to learn about the topic. So if you just take a few seconds to answer that question, that'll give us some information on how read it is among the SOAR community. great. Quite a few of you. We have about 40 folks who said yes, that they are utilizing telehealth and telemedicine. So it would be really great to, hear more about how that's working out for you. So again, Abby is providing some great guidance in this area. So feel free to reach out to Abby. You have her contact information and share a little bit about how that's working out, maybe some of the challenges or hopefully that it's working out quite well. You're able to get the documentation that you need and, all of that good stuff. So now I hand it over to our second speaker, Corey Snell from Kansas.
Thank you. Hi, everyone. My name is Corey Snell. I work for the Kansas Department for Aging and Disability Services. I'll be referring to that as KDADS because it's much simpler. I am the SOAR State Co-Lead and the CABI Project Coordinator. For those of you not familiar with CABI, that stands for the Cooperative Agreement to Benefit Homeless Individuals, and utilize SOAR case managers at all of our sites. Prior to taking this job with KDADS, I was a SOAR case manager and local lead in the Kansas area. So this brings us to a map of Kansas to give you a little idea of what we're working with here. It's on rural homelessness, but as you can see, much of Kansas is actually considered frontier, densely settled rural, semi-urban. The population is heaviest in the northeast region, and there's a little bit in south central for Wichita. With western Kansas being sparsely populated, its outreach and communication across the state a bit of a challenge. So community mental health centers cover multiple counties, and they're far from their closest Social Security office or some of our Department for Children and Families offices, which is a department that handles SNAP, TANF, and WIC applications. So some of the challenges with working with rural communities. Providers can be far from individuals and difficult to reach. There's also high demand for medical treatment that can create longer wait times for appointments. Ways this has been addressed among some of our state agencies is partnering for expedited services. Like we have multiple counties that have partnered for expedited TBI assessments. We also have centers that are integrating their community mental health and physical health into one agency, creating these one-stop shops for individuals. Another way to get around the difficulty with accessing medical providers for individuals is a creative use of the consultative exam, or CE. If you've tried every which way to get somebody in for an appointment, and you're just not able to do so in a timely manner, making note that an assessment would be valuable and getting that CE, though we typically try to avoid CEs at all costs. If that's your only option, that's another option that some of our more rural areas are using. So isolation, as Abby covered, rural homelessness looks different. Some situations I've seen, we've had individuals camping on land that once belonged to their family, camping on remote public lands, living in garages, sheds, barns, not the typical, ways of New York that we often see depicted. So in isolation, it means we as each providers have to become creative in our outreach. One we've done that is using that travel time to build rapport with individuals and gather information for my medical summary reports. I've actually driving home from taking someone to wherever happened to be that they were staying. I would use talk to text on my phone just to make very generic notes so that when I got back to the office, I could add those things to medical summaries. I have to get creative with that outreach. Another strategy that we've used is kind of stacking services to reduce the number of trips for people. So if someone's already coming into the center for, say, a med appointment, you can meet with them, you know, right before or right after, and just try to stack those services as much as possible if, you know, the consumer is open to that. Individuals we are assisting aren't the only ones that can feel isolated in this process. Many of our Kansas SOAR providers are the only trained staff for their agencies. The way that we are working to reduce that isolated feeling is by maintaining a statewide network. We are using local leads as a conduit between the regional workers and our SOAR state committees. Due to distance, we often use telecommunication for state steering meetings and at SOAR regional meetings. Our hope is to have enough local leads in the future to host all of our regional meetings face-to-face, but until that point, we are using telecommunication for that. Leadership academies to train 2 new local leads a year. We're again trying to reach out to that western part of the state that is very sparse populated, as well as keeping enough local leads to handle the work in the northeast corner. So right now we're kind of trying to use one of the local lead slots for western Kansas and one for the more populated areas each year. And as of local leads increases, so will our regional committees. So effective on March 1st, 2016, we started using the SOAR certification process. It's a set of standards that we're using to ensure quality applications are being submitted statewide. So the aim of this process was to strengthen our program and ensure quality, to create a set of standards that are easy to meet for those following the SOAR model already. And we didn't want this process to create any barriers for anyone assisting with applications. We just wanted to ensure quality for everyone. And with this, we're also creating a database so we can maintain connection across the state. Some of the SOAR certification criteria, there is a handout available for your use. Thing is completion of the SOAR online course. We have exceptions for a few people that received in-person training and have been practicing SOAR consistently since that in-person training, but we're really encouraging use of the SOAR online course. And so when completes their online course, I receive an email. I can put that individual on our SOAR certified list, and I can keep contact with that person, you know, again, reducing that feeling of isolation that some of the more rural communities are feeling. Use of SOAR OAT, if we don't have data to back up our work, then our work is going to suffer. I also use the data in OAT to help address technical assistance needs across the state. Usation of the SOAR critical components. I'm sure everyone's aware of this, but the critical components are the 1696, signing on as a representative, collection submission of medical records, submit medical summary report, which is signed by a doctor if at all possible, and completion of a self-review using a quality review checklist. Just a to make sure that you have all your I's dotted, all your T's crossed. We ask there's a minimum of 2 SOAR applications every 12 months. For more, we often see much more than that. But again, in some of our rural areas, they don't have the opportunity to use the SOAR process more than a couple times a year. Annual completion of continuing education. I've actually been requesting that as of late, and I'm seeing quite a few participants from Kansas that are doing one of their continuing education webinars right now. 3 opportunities for continuing education are the SOAR webinars, which we highly encourage. They're all great. The refresher trainings. I recently held a fundamentals training at a statewide summit on homelessness, and I provided a training for our Department of Correction discharge planners. We hold those refresher trainings throughout the year. The webinars are obviously easier for everyone to get to. And then a third option is review of a redacted medical summary. I've actually reviewed several of these this week after checking in and asking for CEs. I've gotten a bit of good feedback from the individuals I've reviewed to find those reviews valuable. So our SOAR certification process, the criteria with my co-lead and with the help of the SOAR TA Center. The list of certified workers is shared with our agency leads at Social Security and Disability Determination Services. These individuals are on our state steering committee, and they help us identify areas for outreach. So if they see that a certified worker on the list is needing assistance on certain steps of the process, they let us know so we can reach out and provide technical assistance. If there's someone that's not on our SOAR certified list that's submitting SOAR applications with, certified written on it, let us know so we can reach out to that person and make sure that they are certified and using their certification. And if there's someone in the area that is routinely submitting really good applications, but they're not connected with SOAR, we often get those names too, so that we can reach out, get the individuals SOAR trained, and get them looped in with our Kansas network. If anyone has any questions regarding our certification process, how we do outreach, feel free to contact me at the information below.
Corey, thank you so much for your presentation. You've provided some really great ideas that will not only work in rural settings, but also urban settings as well. We really, this is the time that I've heard about using a SOAR certification process to increase the isolation that SOAR providers are feeling. So I think that that is a really unique idea that can work almost anywhere, but particularly in rural areas to create that SOAR community among providers. So if anyone's interested in learning more about certification and how Corey does it in Kansas, please, as she said, reach out to Corey. Last speaker today is Ambrosia Crump, who is the SOAR state lead from Nevada. Ambrosia?
Good evening, everyone. Again, my name is Ambrosia Crump. I'm serving currently as the state lead and the coordinator for our Nevada SOAR initiative. So just a little brief review of our state, just to give you guys some context on what we're working with. Our state is divided into 3 continuum of care for our homeless service provision. The bulk of the state's population is actually in southern Nevada. Our state, as of our last 2014 estimate, had a total of 2.8 million total individuals within our state, and over 2 million of those 2.8 are in the southern Nevada area where I am housed. Our other COC has a little bit under 500,000 individuals there in the northern Nevada area, which is the Washoe County the rest of our counties, which are the other 15, are our rural counties, and combined, they only have a little bit over 100,000 individuals total. So just to recap, we have about 88% of that population in just 2 counties alone. 15 out of 17 of our total counties are rural counties. And we might be able to attribute that to the fact that 86% of the state land is actually owned by the U.S. federal government. So that may be helping us to explain that disparity in the distribution for our population. Also, mining and tourism is a predominant industry for rural Nevada. We still have a pretty high foreclosure rate despite some of the improvements that we've seen since that Great Recession. And rural Nevada is dealing with a little bit higher unemployment percentage on average when compared to our state overall. About a lot of these things already. Challenges in rural Nevada, we have those same themes as well with isolation. Obviously, with our state being very large and with a very small population, if you're homeless, maybe no one knows about that, and maybe you don't know how to reach out for help. So you're experiencing isolation in that scenario. And then sometimes homelessness may be viewed as an invisible problem in the rural area. If we traditionally think of homeless individuals as those who are the street homeless, that may be pushing a cart in a paved rural urban area, we don't really perceive folks who are maybe staying on campgrounds, who are staying in abandoned trailers, moving from different motel to motel as folks that are homeless, and they may not perceive themselves as homeless. And so that perception does have an impact on our awareness in that community around homelessness, whether or not that's an experience that they have there. And so that also may affect ability to come together and get that funding that we need for that area. It leads us into our infrastructure. We do have state-funded medical and mental health resources in our rural Nevada area. We absolutely use that telehealth, telemedicine option, but we still have a ways to go when it comes to supplementing our current resources with the best practices that we know that are out there in the nation at large. And so funding continues to be a challenge. Also, we do, just like most communities, we struggle with having the resources for that are homeless specific as well as medical and mental health resources. And transportation, as you saw, our state's pretty large with land mass, very small population in our rural area, and challenge transportation, public transportation for those who have little to no income, and those who are homeless will challenge. Finding out ways to leverage those opportunities that Corey talked about is definitely key. Housing, although most of our counties have a resource either by subsidizing housing, if that's a need for those folks who are struggling, there still is not a lot of stock out there. So our counties are coming together pretty soon to host a rural housing forum on October 25th in Nevada to hopefully address some of those issues. So to give you guys a history of SOAR Nevada, for the Nevada area, we were part of one of the prime efforts with Social Security trying to reach out to homeless individuals to help them better connect to benefits. We were one of the awardees for the HOPE project, which was a Social Security demonstration project, which stood for Homeless Outreach Products and Evaluation. And again, we were given those funds to try to better connect with security our homeless individuals in our community. So we were part of that initial pilot process, and a lot of those best practices are some of the things that we took with us, and we also got involved with SOAR on a national level. We were also one of the first states to adopt SOAR in our state. We definitely benefited from the SAMHSA SOAR TA in our community, and we did provide that 2-day live training the way sorting was traditionally provided. However, we didn't have any staff dedicated to this process. Majority of the folks that provided that training did so on a volunteer basis. They were advocates for the homeless population. Maybe they were case managers who were excited about what SOAR could do for their clients. But beyond training, there wasn't anything to really sustain the movement and maybe maintain that momentum that people may have felt once they walked out of training, so that they were comfortable with providing good service delivery going forward. So I like to call our next stage SOAR 2.0. So we were fortunate enough to be awarded CABI States funding in 2014. With that funding, we were able to secure SOAR coordination, which is my role now. I transitioned from a direct service case manager to this role because we obtained that resource. And so now we have a SOAR certification process. It's a two-part process. We ask all of our trainees to complete the online curriculum, and then they're invited to our Nevada Fundamentals workshop. So one that we found was helpful staying our program because of its infancy, even though we've had the program in-house a long time, we haven't had the ability to support it on a state level. It was important that we were more strategic in our ability to support the programs across the state, especially when it relates to our folks who are in the rural areas. And so we felt that collaboration, connection, consistency, and communication are key. So when collaboration, I'm talking about statewide support. So our governor is the Nevada Interagency Council on Homelessness. So this is a statewide coordinated effort to address homelessness. And we have members from all continuum of care, and that includes our rural partners, local service providers, and any stakeholders that maybe touch our homeless population. And so when they came together and had this coordinated effort, they came up with a strategic plan around some of the goals they'd like to achieve to help end homelessness, and they saw SOAR as a valuable intervention to do just that. And so as you can see with this example, they've written in some of their goals and what the strategy of applying SOAR training, making sure it happens throughout the state, including our rural Nevada areas, to ensure that resource is viable for our partners who need to know that information so that they can help support their clients connecting to benefits. And that CABI State grant really served as that financial arm so that we can make that happen. So that's how we fund the training across the state currently. So we talk about collaboration on a statewide level, making sure we're working smarter, not harder, coming together and planning in advance. Our connection is really this online SOAR training. It's helped us to bridge the gap between information in maybe the more populous areas like southern and northern Nevada to folks who may be needing to know more information, having another tool in their belt, but really not having that opportunity or availability for training where they currently are working on their island, what I like to call those islands in the rural areas. So online training is a real-time accessible tool. They can do it, they can access it at any time as long as they have access to the internet. It's flexible. If they need information that is applicable right then and there for a client who may need that information, it's a great resource until they can get some support or technical assistance from the state at large. So as you can see, we've had 13% of all of our online trainees are from our rural area. So we see it as a great tool for us. About collaboration, we talked about connecting people, and then the other important thing is consistency. So what we did is we heavily adopted from our SOAR Leadership Academy material to develop our Nevada SOAR Fundamentals course. And so this is part 2 of SOAR certification in Nevada. All trainees, no matter where they're trained across the state, are asked to participate in a 6-hour, one-day workshop. And it's important for our state, at least, for us to have this workshop because we do have a different submission process for SOAR claims in our state. It's different from the way it may be in the online course. So it's important that they know how to do this in their community in its process. So with that, DDS, which is Disability Determination Services, we have a great relationship for our SOAR program here in Nevada. They are willing and able many times to come to any of our trainings, and that includes the ones that we've held in the rural areas to reinforce the procedures that our trainees are supposed to follow in order to have those claims flagged as SOAR and treated that way. And then also, last but not least, we make sure that all of our trainees walk away with understanding their responsibility around reporting outcomes for the work that they do. Right now, we are using HMIS, which is our Human Management Information System. It is a statewide database for our homeless service providers, and so we do a walkthrough to ensure that they know how to submit their outcomes through that resource if they have access to that. And of course, if they don't, we have a backup process for them to use to do that. We talked about collaboration, connect people using the online course, having that consistency, making sure everyone hears that same message across the board no matter where they are, including rural Nevada. And so what happens after training? It's important that people have a lifeline to reach out to. So communication is that last key critical component that we see as being helpful. We publish a quarterly statewide newsletter. So any SOAR trained in our process, whether they are grandfathered in by attending maybe a 2-day process years ago, 2-day live training version years ago, or they've just recently certified, they're added to our email list. That also includes any COC members, so any supervisory staff for homeless service agencies, COC coordinators, our Social Security contacts, and our DDS staff as well all get this newsletter. And so what we report on is the outcome reporting process, so everyone's aware of the expectations that they have and when they should do that, when are outcomes due, what are the upcoming training opportunities in their community, SOAR-related jobs, any changes in our Nevada SOAR procedure, because we do have a specific procedure that's outlined and disseminated using the newsletter. And so this just ensures that everyone gets the same information at the same time, at the same level, and that practitioners are aware of the resources available to support them above and beyond that training experience. So again, we're still building our capacity in our state to practice SOAR. So we still have some things to do to make sure that we have a good program going forward. One of the things that we do need to make sure that we do is identify a replacement rural Nevada local lead. We do also send staff to the Leadership Academy, and those local leads in the northern, southern, and rural area co-facilitate our Nevada Fundamentals courses. And so once we identify those folks to have them trained and brought on board, we'll hopefully have more capacity to host those classes going forward. Also, we are exploring, we just access to WebEx software, so we're exploring maybe providing that Nevada Fundamentals training because it's so critical to practice in a web format. It may look like potentially a series broken up over the 1 or 2 hours as opposed to a day-long course, just to be easier digestible for our population who may have to remote in, who can't attend a live class because there's not one available in their area. So, thank you so much for your time. Here's my contact information if you do have any follow-up questions on what we're trying to do here in Nevada.
Thank you much, Ambrosia, for your presentation again. Loaded with some really great ideas that will work almost anywhere for folks who are familiar with our core SOAR critical components. Both others really touched on them. I think the most important one that they equally mentioned was the relationship with SSA and DDS. So when we get to Q&A, which is now, we're going to ask both of them to focus on how they were able to build that relationship and how that has really helped you move your SOAR program forward in your rural areas, having that relationship. Would you like to talk a little bit about that for SOAR certification and how SSA and DDS value that?
Sure. So our Social Security representatives and our on with Disability Discrimination Services were actually at the table helping us create the certification process. We created it in our SOAR statewide steering committees, which we have, I believe, 5 of the Social Security Administration agency leads on that committee and our one DDS liaison. We got great feedback on it. We do get a lot of input from agency leads on this person doing a really great job, this person used some technical assistance, this person could use connection to SOAR certification, is this person SOAR certified? I mean, it's a pretty constant, those through email, obviously, but I'm getting emails on a daily basis regarding SOAR, either from leads, SOAR in the state or our agency leads, it seemed to improve the quality of applications, if not necessarily just through the certification process itself, but through having that network that's created through the SOAR certification process, helping us to identify technical assistance needs for everyone.
So everyone can download the Kansas SOAR certification process if you're interested in reading more about it. Again, you can get that on our SOAR website. Oh, the chat function, you can highlight that, the link to the SOAR website, and that's where you'll find the certification process. So you can see the Q&A box has been open, so you can feel free to write your questions in there. We'd love to answer some of your questions. We have plenty of time for questions. And Bridget, we have a question for you. It's about your online course. Can you talk a little bit about how you facilitate the online course, and part two, which is part one, and then part two, when folks are coming together for your SOAR fundamentals training. Can you talk about how that's done in person, and if you have any plans on using technology such as WebEx to do these SOAR fundamental trainings, via WebEx or another platform?
So for the online course, currently we, whenever we can, we try to host a cohort, and really what that is a group of individuals that are going through that online course process together at the same time. We do have them complete a registration for that process. We ask that they have their supervisor sign off just to ensure that they're aware of the fact that they're participating in that training, if that's something that's required, just so that they are allotted that time needed to complete the training in addition to their usual work duties. So with that registration, we get contact information on all of the enrollees, getting a notification from the supervisor that they're participating in training to allow them opportunity to complete it. And then also the expectation to apply what they've learned in practice, hopefully with clients as they're able to. And so usually what will happen is we'll schedule a date for the cohort to start. Typically our cohorts are divided over a period of 6 weeks. And then some people individually work at different paces, but we try to keep a schedule. Usually at this time, currently follow-up is done weekly, mostly via email. Sometimes we recap some of the basic information that's shared in those particular class modules, maybe give them some examples to apply or to maybe think through to assist them with processing information they're exposed to. Our goal is to incorporate the technology that we've recently received with WebEx to host maybe weekly teleconferences, and maybe including some visual aids as well, like PowerPoint, to engage them in better digesting that information that they are exposed to via the online course, and so to also bring them into what I would like to call a family, a SOAR family, so they're not feeling like they have to get through the process alone and then be expected to practice alone, especially if they're in those rural areas where maybe they don't have colleagues who've gone through this or who have utilized SOAR in the past or are familiar with Social Security benefits. So that we're doing now, SOAR fundamentals, because we have the CABI grant, I'm able to travel and facilitate that with the local leads across the state. We're going to grow our group of local leads so that eventually they can assume a lot of that role themselves without a need for me to travel necessarily. And just in the event that funding is not available to do that, we're just blessed at this point to have that now. So that's how that's happening. And we have, like Corey mentioned, we also have DDS leads as well. So maybe if someone's not aware that we have a cohort process and they just found the course online independently through maybe a Google search or just trying to figure out how to help clients. A lot of times that's what happens. Our DDS staff will let us know, hey, someone tried to send us a referral or called us to ask for this. I know you guys at the SAMHSA SOAR TA Center have also been helpful in sending us leads as well to notify us of someone's enrollment or if they're completing that course, and then we make sure to follow up with an invitation to a Nevada Fundamentals based on what's scheduled for here.
Well, you've built a really solid relationship with DDS, so that's great news about getting referrals and supporting the online course as well, and getting information out to everyone. So we have a question here for Corey. Corey, this is from Merritt Moore. What types of support or activities does your statewide SOAR committee do to assist the SOAR work in your state and to ensure quality applications are being completed? Corey, take that one.
Yeah, so one thing we do is that the local leads are all on our SOAR statewide committee, and they often bring to us at the statewide committee the concerns that are brought up at regional meetings or emailed to them throughout the year. That we brainstorm together as the statewide agencies. Oftentimes, issues that are brought up are systematic issues, like having trouble reaching somebody at this Social Security office, or I'm trying to request the previous claim CD and I'm being told that I can't, and the agency leads will help us with providing policy and procedure codes that yes, you can access that CD. So just having everyone at the table to provide those ideas and to give feedback. Now, on actual application basis, less than a statewide systematic issue, we do talk sometimes about, hey, applications from this region a lot, and either MSRs are very long, or sometimes there are some agencies that stop using the MSRs, or they're submitting their medical records upside down, something of that nature. Just getting that feedback from DDS and Social Security, I can then reach out, hey, you know, when you're filling stuff in, just so you know, it's coming in upside down. If you could flip it to make sure it's easy to read for people, or, you know, I'm happy to come meet with you to talk about medical summary reports, just things like that. Does that answer your question?
Corey, I think that more than answered the question.
Great.
We know that having the certification process, it's a given that applications, you'll see quality applications being filed. So I think that, you know, definitely a good idea having the specialized certification process. And we want to differentiate for folks that are not as familiar with SOAR, new to SOAR, that when you take the SOAR online course, that is the first step. Once you complete the online course, which means also submitting the practice case file that's attached to it, once that's submitted and you pass the course and you get your 16 CEU credit hours, that's the first step. If you complete that course, yes, you know, you SOAR, what we call SOAR certified. You know, you've taken a course, you've passed it. Now, many states have their own set of criteria for actually filing SOAR applications. And as you heard from Ambrosia in Nevada, there are two parts. Part one, taking the online course and passing it, and part two, coming to a SOAR fundamental training in person, and in the future, possibly doing that through a WebEx, doing that that way virtually. In Kansas, a SOAR certification process. You take the online course, but there's other criteria, other factors that you need to take into consideration before you can actually file a SOAR application with SSA in Kansas. So I just wanted to throw that out there for folks that might be confused. And again, if you've taken the SOAR online course, if you found it, you know, by doing a Google search or finding it on your own, and you want to file an application in your state, go to the SOAR website, find your state, click it on, and contact your SOAR state lead or your SOAR technical assistant TA liaison. And we can talk you through what is required in your state to fill application and connect your state lead or local leads so that you can, again, be folded into the SOAR initiative there. So we have another question. Isla Mulvey. Extremely rural areas, extremely rural, having trouble.
In extremely rural areas, how do you find people to outreach to? Is it word of mouth? Do people call in response to flyers or something? So I think she's asking, how do you find individuals to work with?
So this is Ambrosia. Because we don't have a lot of dedicated SOAR practitioners or really even a coordinated community referral process anywhere in the state, one of the things that has happened is just maybe people that already work with homeless service providers a lot of times find, again, what Pam mentioned earlier, find my information online. They're not aware of the fact that they're not really a place to send their client, but sometimes they find it online. Another way is maybe providers who are not traditionally homeless service providers, but maybe medical or mental health providers. At one point we had one of our center representatives, a lot of times they get referrals for their key managers for Social Security advocacy because maybe constituents needs assistance. Had them attend the SOAR fundamentals to give them exposure to SOAR so they're aware of that resource. And I'll get calls from the senator's office saying that they've run into a constituent who may need assistance, may need outreach. And so what I do is I maintain a comprehensive list of anyone that we've ever SOAR trained throughout the state and what county that they reside in. And I try to reach out to those people who I know have had that SOAR certification to see if they're in that particular county, for example, if they're able to intervene and assist that person who is nearest to them. That remains a challenge. However, at this stage, because SOAR practice is still fairly new in the rural area, that's how we've been handling it as of this point.
This is Corey. Just to jump in a little bit on that. One of the additional ways that we've had is the use of PATH providers. So PATH is a federal grant outreach to homeless individuals. And our PATH providers are all very well versed in SOAR. Some are SOAR trained, and oftentimes we get referrals from the PATH workers. And I get a lot of calls just from having my information on the SOAR website too. That's my input on it, on top of what Ambrosia already mentioned.
Yeah, thank you. That was a really comprehensive answer. We appreciate it. There was a question that came in from Sarah Gibson, and there was a mention that there are a minimum of 2 applications that need to be submitted a year, and this is referencing Kansas's certification program where they require 2 per year. Is that a requirement for anyone that is SOAR certified to do this and to maintain certification? Now, I just wanted to kind of clarify that again. We may have folks out there, who are not from Kansas, who are from other states, and the answer is no, that's not a requirement in many of our SOAR states. Again, that's why I want to find out, click on your state, find out who your SOAR TA Center liaison is so that we can update you on what is the requirement for your particular state. Again, Corey is speaking to a certification process that she set up, again, to help case managers be less isolated, to increase the quality applications. She found that folks that went through the certification process are actually filing SOAR applications, which is, really our goal. Is to see more quality applications being filed. So hopefully that answers your questions and it's less confusing to you too. Okay. Question about refresher trainings. A question came up, how often do you do refresher trainings? I haven't had any refresher courses since my 2-day training. So again, this is from Angie Rector, and this would be, again, an example of, Angie, I would definitely suggest that you get onto the SOAR website, click on your state, and get in contact with your SOAR TA Center liaison. I think that, again, we're not offering any more two-day training, so we really want to make sure that you're up to date on what, SSA is requiring. So it would be wonderful for you to take the SOAR online course and also connect you to folks, local leads in your area, or, we can just really update you on what's going on in the state since you attended a two-day training. So again, we'd really encourage you to do that. Get in touch with your TA Center liaison to connect.
Came in, and I think this is a great question for many people who are looking to build relationships with SSA and DDS. Both Corey and Ambrosia, you mentioned having really positive relationships with Social Security and DDS. So when you were first starting out, what steps did you take to build these positive relationships?
So we're still,
go ahead, Ambrosia.
This is Ambrosia. We're still in our fledgling stages for SOAR practice, even though we've had SOAR in our state for a while. But one of the things that we initially did is reached out to the public information specialists in the area that represented those local Social Security offices, invited them to our SOAR fundamentals. A lot of times at first they participated as just an attendee, and offered the opportunity to make comment on the areas when we did training around Social Security specific information, to really defer to them as the subject expert matters when it came to Social Security eligibility and criteria. And so I think just maybe respecting their role in our relationship initially by asking them to give us their information in the training environment and honoring their participation just with that experience alone allowed us to develop a relationship to where now we don't have a state steering committee, but we've been building, at least in my local area in Southern Nevada, a new Southern Nevada steering committee that includes SSA representatives at the table, and we are exploring SOAR practice with involvement with the local security office. Security office that's not in place right now. Our SOAR intervention is primarily at the DDS level, but I think really just honoring their role, what they bring to the table, also respectful of their needs at the local level, and trying to maybe present or position SOAR as something that could be advantageous to them, and maybe reducing processing times on their end so that it's a win-win situation.
Hi, this is Corey. Just to join on that question. One of the big things we've been doing is we've been invited to present annually at the Disability Determination Services just annual meeting, just to go over what SOAR is, how we as SOAR providers, our goal is to make the job easier for the examiners. You don't want to make their jobs more difficult. So just getting that feedback from them on what helps from SOAR providers, what can be a challenge from SOAR providers, and just explaining what that medical summary is and how it can be helpful to them. And also just reaching out to local Social Security offices and just explaining how the SOAR process is developed to make it easier and more streamlined. Streamlined is the best term for it, to streamline the process for everyone involved. Mostly for the consumer, but we want to make sure that the agencies and the representatives have the most streamlined, easy to follow process as possible.
Corey and Ambrosia, I think you provided some good examples on how you forge relationships with DDS and SSA, but specifically DDS. We know SOAR providers, that's where you're really spending a lot of time with the DDS examiners. So really having that relationship and them provide feedback on their procedures and expectations, I think is really, really important. So that consistency that Ambrosia talked about in her presentation is really key, again, to streamlining and making the process more efficient. So we have a question here, and this is for, we'll start with Corey and then Ambrosia. I'd like you to chime in as well. The question comes from Jan Wells, and she's asking, is there any grants or funding sources for nonprofits to apply for so we can implement the SOAR program? Can you talk a little bit about how you're funding SOAR?
So in our state, we just received the CABI grant, the cooperative agreement. It's not technically a grant. Our state received that exactly a year ago. And we've used that to add a multitude of new services to 4 different sites in the state, one of which being SOAR. Another way that we funded SOAR is through the PASS grant as well. And I really love just watching the newsletters that come in from the SOAR Works TA Center. Oftentimes they are addressing SOAR grants. There was one I actually emailed agency lead about that was for cooperative nonprofit agencies working together. I'm forgetting the name of that grant, but it was in a SOAR newsletter. I also know if you reach out to, I believe, Matt at the SOAR TA Center, he can give you ideas of grants that your agency specifically could apply for. Most of the ideas for grants come from a statewide level at this point.
I would say, as Corey has expressed, that we definitely differ the newsletter when it comes to finding out about potential grant opportunities. Our program is also, well, at this present time, solely funded through the CABI States grant, so we have the opportunity to have it for a few years at this point. And then with having the increase in outcomes, as opposed to not having that coordination with that funding that came with it before, recently we've shared that information on a statewide level to leverage that to pursue maybe some more sustainable funding going forward, hopefully. And so we're maybe more looking at this as an opportunity towards the future, although we don't have those things in place now. I'm really advertising what we've done for our consumers in our state and how we've changed their lives, but also showing the numbers that we've been able to achieve as well, I think is what we've done to pursue state-level funding. Private foundation grants, a lot of times for nonprofits, are a good resource. I think with SOAR, because you can't give an outcome as opposed to maybe taking on a idea. A lot of times that may be something that's more digestible for that population of funding, so that may be a good idea. But we do get a lot of leads from that newsletter as well.
Ambrosia and Corey. Question, just want to know that we, if you, under the participant tab in the chat, you'll find the link to Foundation Center, but also on our website, we have a whole page of resources on funding opportunities. So I'd encourage you to click that on, and of course, as Corey mentioned, at the TA Center, Matt Knutson, he can provide some detailed funding reports for you, too, using Foundation Center. So, again, we encourage you to reach out to Matt at the TA Center. We have a question that came in from Michael Rowcroft. The question is, how does SSA and SOAR coordinate with the VA, the Veterans Administration, and HUD-VASH programs helping homeless veterans? So we anticipated this question, so we've also provided the link on our SOAR website for our veteran resources, and there you'll find loads of information on specifically SOAR and VA coordination. So that will be very helpful for SOAR providers to work as community partners with the VA or also VA staff. So again, we'd encourage you to check out, and you'll find information there too as well. I have a question for Ambrosia about your quarterly newsletter. Can you talk a little bit about that, the time it takes for you to put that together, and how that helps you strengthen the sense of community in rural areas. Geography is a big issue where you're spread out very far. Can you tell a little bit about how that came about, doing a quarterly newsletter?
Well, some of our COCs actually publish quarterly newsletters. I know in the Southern Nevada area, we had an advocacy arm called the Nevada Homeless Alliance, and they have a newsletter that they publish around efforts in our local area towards addressing homelessness. And so I was very fortunate in having a colleague who paved the way to expose me to that resource. I use a tool called MailChimp. There are things also that you can use that are on the same vein, such as Constant Contact, with little or no fees involved. And a lot of times they have templates that you really just fill in the data or information or drop a picture into. It looks like a lot more work than maybe it really is, because a lot of it is already driven by their software. And so with me finding out that resource from a provider in the homeless community who also uses something similar to meet their strategic initiative goals and to communicate to the consumers of their information, I just started doing that to do the best with what I like to call a one-woman show at this point. I'm kind of it when it comes to our SOAR program, because it's new and newer in Nevada when it comes to coordination. And so I had to find a way to get creative and have something that would use little to no resources but could hopefully make a big impact across our state.
Thanks, Ambrosia. We enjoy reading your newsletter, too. It's loaded with some really great ideas, and it's great to hear, read about the shout-outs to folks, SOAR providers that are working really hard on submitting claims, and hear about how, being a case has really helped transform the life of the SOAR applicant. So we enjoy it. It's very creative, especially our last issue, the Summer Olympics. I think you really helped folks really understand how important it is to track and report their outcomes, SOAR outcomes. And I think that you really helped make a bit of a competition, and you made it fun process. So that was really great to read about. So we have another question here about, let's see. Question is from James. How do you ensure the state and regional resources, so state and regional resources, are made accessible to the frontline rural workers? Corey, do you want to take that one?
It's mostly use of local leads reaching out to those rural workers, as well as me personally reaching out to those rural workers. For state and regional resources, we really have financial resources that we can distribute to rural communities, but more resources and connections, the correct applications to be using, the correct forms, the right person to contact. Make sure to use those local leads, again, as a conduit between their regional workers and the state committee, and again, from the state steering committee through the local leads down to their workers. But again, everyone in the state is welcome to email me if they have questions or concerns, and oftentimes, like, we received that newsletter regarding the updated Blue Book listings that are coming out, and I'm sure to send that to all of our certified individuals. I usually let the newsletters just speak for themselves rather than double hitting people's email. That one I felt was really important to give everyone a heads up on, and to let them know that there were webinars coming available, as well as a reminder that if you haven't signed up for the SOAR newsletter, to do so. To jump back on the reaching out to VA, we do have a VA representative on our SOAR State Steering Committee, so that's one way that we try to keep in contact with those programs. And I did remember an additional source of funding that for some reason I forgot, Medicaid. I've been encouraging the states to track their Medicaid reimbursement so that they can show how much money they are bringing into their centers by helping with a SOAR application. Oftentimes the Medicaid reimbursement is plenty to cover the cost of the SOAR worker. To jump to a couple of different questions.
Now to remind folks out there about, recouping, the cost of hospital services through Medicaid reimbursement. So it's a good reminder on that too. So thanks a lot for that. I have a question about both you, Corey, and Ambrosia talked about annual housing summits. Ambrosia mentioned there'll be a summit on rural homelessness. Can you talk a little bit about how you utilize these annual meetings to help for providers who, again, may not be able to get to meetings on a weekly or monthly basis, but how you use these events and focus on getting some SOAR work done at the state level? Can you talk about how SOAR, plays a part in some of your annual meetings?
Ambrosia. So with that particular summit that's coming up, to have the capacity to have teleconferencing for folks who are not able to join live or in person to the meeting. And so we're fortunate to have resources in our state that allow us to utilize those, and we need to make sure that we have the opportunity for folks to participate in things that are of interest to them. I know last year, once we started to really build our capacity to practice SOAR, one of the things we did was host a statewide forum, which included members from all three of our COC, partners that work maybe not necessarily in homeless services, but maybe touch homeless individuals through the work that they've done, being medical providers, mental health providers, legal advocates, and in addition, our local partners who do service our homeless population. And so we use that opportunity to share about SOAR, just a brief overview of what SOAR is, what training looks like, what SOAR can do for our community and our state as a whole. When there's those opportunities to do that, like they had a SOAR-specific forum, whenever our COCs have meetings, if I'm available, I do participate. I try to give updates on where we stand with our outcomes, to communicate training opportunities when they have their meetings, and that's at the COC-specific level. So anytime our three COCs meet and I have that opportunity, I try to join them, even if it's teleconference, to share any updates around what we're doing with SOAR. So a lot of that is just really using that technology to participate when we have events that are taking place.
Anything to add in terms of an annual like homeless summit or housing conference where you try to embed a SOAR workshop or even a SOAR fundamentals training?
So spring, our state holds a statewide summit on homelessness and housing. This spring it was in Manhattan, Kansas, and prior to I was actually asked to help present the SOAR fundamentals training when I was a local lead and prior to being asked to present for the fundamentals training, I personally hadn't heard of the statewide summit. It was typically for our PATH providers and other ACs that worked with homelessness and housing. So when fundamentals training opportunity came up, I just made sure to reach out to all of our certified SOAR workers to make them aware of this annual summit, and I will be doing so again this coming spring. And the fundamentals training, the half day that we got to give fundamentals training was very valuable, as well as all of the other presentations that were given at that statewide summit that I believe many of our providers wouldn't have been aware of had we not reached out to them. So just to not only reach out to our SOAR workers on SOAR-specific things, but, reach out on helping the homeless and helping to access housing, any general advice and connections we can make as possible.
Thanks, Rosa. I think that especially given, rural states that you are from, how hard it is for folks to travel to meetings, and by incorporating some sort of events at an annual meeting, knowing that that may be the event where you're going to see likely folks interested in SOAR, that you're utilizing that. And again, we just wanted to let folks know that your SOAR TA Center liaison would be more than happy to join meetings that you may, be having through teleconferences or Adobe Connect, for example. We love to join that and share some new products that we're developing, and really talk more about, again, some of the tools and products that we've developed too. So please, again, feel free to reach out to your SOAR TA Center liaison for participation in any, meetings that you have. We'd love to join. So we are out of questions right now, and again, I think the presenters really provided a great picture of what rural homelessness looks like in your area, and again, provided some great ideas that really will work in any part of the country, rural or urban. So I just want to thank Corey Snell from Kansas and Ambrosia Crump from Nevada for a wonderful presentation, and to remind folks that Abby Lemon here at SOAR TA Center has written a one-pager on rural homelessness in general. So I really encourage you to read that to get some more information on how rural homelessness may impact your SOAR program. So I want to remind folks that you'll be immediately directed to an online evaluation. So we'd love you to take the time out to fill out and also put ideas that you may have for future webinars. We really do appreciate and value your feedback. So again, thank you so much for participating in today's webinar, and have a great rest of the afternoon. Thank you.